Hello, I hope you are doing well. I'm looking forward to talking with you. I wanted to first send this video over to you. I know obviously in an ideal world, I wish I was with you and doing this demonstration with you in person, but we want to make sure that we are keeping everyone healthy and following the rules of staying at home. So I wanted to do this video for you. That way when we talk, you kind of have a frame of reference with this video. So that way you can kind of think of any questions you may have. This video may answer some of those questions you may have, or may spark other questions that you may have for me as well. Just kind of exactly what this Flexitouch will be doing for you, as well as kind of why your doctor or your therapist was recommending it. Okay, so I wanted to kind of show you a few things. Obviously, I want to show you the device. I kind of want to show you how you will be donning and doffing it, the training aspects of it, and what exactly it will be doing while it's on. Okay, so first things first, I want to kind of show you is this device. Okay, so this is what the device will look like. Okay, it plugs right into the wall. It will already be preset to you. Okay, so you will not have to worry about anything on working with this screen at all when you have this. It will already be preset when you receive it. All you will have to do is plug it in and hit that enter button to start it. Okay, one treatment is 1 hour, so you will be doing it once a day for 1 hour. Okay, it starts with up in your abdomen. Okay, so there are two parts. There's a part that starts up in your abdomen, and then there's a part for your legs. Okay, what happens is for the first 30 minutes, you'll be decongesting. So what's happening is we want to make sure we're clearing out all of those lymphatic pathways and just making sure everything is kind of clear, and those working lymph nodes that you do have are definitely open and clear. So when we start pushing all that fluid up that's kind of sitting down in your legs or in your abdomen or in your thighs, there's a place for it to go. Okay, so for the first 30 minutes, it's going to be starting up in your abdomen. It's going to be working its way down to your thigh, to your calf, and down into your foot. Then for the second 30 minutes, it's going to be down in your foot, your calf, your thigh, and back up to your abdomen. And that section is going to be doing the drainage. Okay, so what we're doing is exactly what you would be doing if you were at therapy. Okay, so a lot of the physical therapists, what they're doing is a manual lymphatic drainage massage. Okay, so I'm sure while you're with them, what they do is they kind of teach you how to do a lot of what they do on your own. So that's self MLD. I know sometimes it's very hard for compliance to kind of, remember to do those. I know there's a lot going on in life, and sometimes you can just forget. You get your mind going and it's just not part of your daily activities. It also can be difficult. So I know sometimes range of motion wise, getting all the way down to your feet and massaging all the way up can be a little bit hard. So this is an easier way and a long-term way to kind of help you out. When you're done with therapy and you're just kind of at home, that way you don't kind of backtrack. We want to make sure you are constantly making progression and getting all that fluid out. And when that does happen, we maintain. We want to make sure that we are keeping all that fluid out and a lot of that fluid isn't starting to drain back down into your legs. Okay. So as you can see, like I had said, there are two parts to this. Okay. This abdominal component, this trunk piece, looks like a little pair of shorts. Okay. And you put them on just like you would your pants. All right, so they have these little straps here that you step into like this, okay? And you pull these up, and there's this little pocket here that helps you bring those across, okay? You want to make sure you have a little bit of room, okay? So you want to make sure that they're not super, super tight. We want to make sure that there is room for the garment to inflate and deflate and not be too tight. So it shouldn't feel like your garment sleeve or any of those, that compression sleeve that's really, really tight. It should be very easy to kind of slide these on and off. All right. The second component is this leg piece. Okay. Same thing. It almost looks like a little boot. All right. This right here is right where your heel goes, and you'll feel it when you slide it on right where your heel should go. It will go past your toes too. We want to make sure all that fluid, even down in your feet or your toes, is getting pushed out as well. Same thing with that, this piece. There's these little straps to kind of help you as well, okay? So again, you just slide it on like you would a boot, okay? So you just slide that on like that. All right. And then that goes on your leg like this, okay? These components right here are they may overlap just a slight bit. That is perfectly fine. And even if there is a little bit of space too, that is fine too. Depending on sizing of everything, we just want to make sure that they're pretty close together. Okay, so what will happen is, like I had said, it's going to start up in your abdomen, decongest, and each section is going to be about 5 to 7 minutes, depending on size of that. We're decongesting everything. Then obviously we're pushing that fluid back up. I would recommend kind of going to the bathroom before you sit down. Again, you're doing this for a full hour and it's a lot of drainage of fluid. So again, I would recommend kind of going to the bathroom before you sit down. You may notice you urinate a little more frequently. If you don't go to the bathroom, or if you do and you still feel you need to go to the bathroom during this, you absolutely can pause it, go to the bathroom, come back, and resume it again. Absolutely do that. Another thing too I have a lot of questions about is the pressure. The pressure is very light. I have a lot of people who will fall asleep during it. Again, because this will turn off automatically, if you do fall asleep, just take it off when you wake up. It will turn off automatically. It's not going to go on for hours and hours. If there is, however, a place in your leg or in your abdomen that is a little more sensitive, we do have the capability of kind of changing the pressures just in certain areas. So just because you have a wound on your calf or you just have sensitivity around your knee, the whole machine doesn't need to be decreased in pressure. We are able to just decrease the area where you are having that sensitivity and kind of keep it at lower pressure until we need to bump you up to that regular pressure when you start kind of feeling this and being used to the pressure of this. Okay. As you can see too, and I'm going to kind of have this on so you can see these inflating and deflating. Each one of these little components will inflate and then deflate. So as you can see, not more than one will ever be inflating at a time. So you won't just like puff up like a big Michelin man. But each one will be kind of inflating and then deflate and then inflate as it's going up. Okay. Another question too I always get is the sound of it. As you can kind of tell, it's very, very light. Sorry, excuse me. The sound is very, very light. So if you do end up falling asleep, it's not super noisy for your wife, for your kids, or anyone else that may be in your house as well. Another question I always get too is the position that you should be laying in. The best position is definitely like laying down, making sure you're nice and flat. The reason why is we want to take gravity out of it. So obviously if you're sitting like how I am now, you're kind of working against gravity. So laying at that flatter angle definitely works against gravity, and it's a little bit easier for that fluid to be pushed up and out of your legs. Another thing too is when you think about like a hose and you're trying to get water out of a hose, when the hose is a little bit bent, like your hips right now, it's harder for that water or that fluid to get pushed out of that hose. So same thing with this, you want to make sure you're a little bit flatter. It makes the pathways a lot easier for the fluid to get pushed up out, okay? You don't have to be laying flat on your bed. You can lay on your bed. You can lay flat on your couch. You could lay in the recliner. We would just want to make sure that you're nice and open like this, okay? I also want to show you how you would take them off. So obviously I showed you how to on them, then we also want to show you how to doff them, okay? So same thing as putting them on, you just slide it off. Again, it should be nice and easy to slide off because we don't want it super, super tight to your leg or your abdomen, okay? Again, same thing with these shorts. You're gonna take them off just like you would a pair of pants, okay? You just slide them on off like that. All right. All right, perfect. So I wanted to just go over all of these kind of with you just because that way you have a frame of reference, like I said. We want to make sure that you are taken care of no matter what. So you are our main priority, and we've kind of found as a company that this is our best way to still be able to take care of you, again, with all of this stuff going on. Another thing too is when this device does get shipped out to you, like I had said, this is already going to be preset to you. Same with the garments. Obviously, normally on a regular basis, a trainer would come out and set you all up. They'd fit you all to your garments with the Velcro. And then they would just kind of sit with you, make sure everything's going right. With obviously this stay at home going on right now, we cannot do that. When all of these restrictions get lifted, we will be going back to that. We are doing virtual ones, so we will do video chat, and I will be showing you, or another trainer will be showing you how to put them on and off, how to fit them to you, how to plug these in, go over all of those things with you. Same thing or over a phone call. However we can help you out the best we can with the circumstances going on. Again, like I had said, I am your go-to girl. So if you need anything, whether it be tomorrow or in a week or a month or a year from now, we can help you out. So if you needed another training a month down the road, we can have another trainer come back out a year down the road. Anything like that, we can definitely help you out with, okay? This is definitely something that we want to make sure you have all of your options and all of your tools in your toolbox to help you start to get better. This is a long-term option for you to help yourself with while it doesn't take a whole lot of time, so you don't have to wear them all day like your compression garments. Just slide it on where it's almost like a massage. The pressure is very light, and the results are amazing too. We just want to make sure you're feeling better and getting that heaviness out of your legs. The cellulitis, we want to make sure it reduces the cellulitis by a lot as well, and we just want to get you feeling better. So if you have any questions, I hope these kind of answers maybe some of the questions you may have had, may have brought up more questions that you can ask me, but I think this is a good way. That way we talk and you kind of can see it, you know exactly what I'm talking about as well. But I look forward to working with you and talking with you and hoping you start to feel better. Hope you have a great day, stay safe, and stay healthy.